Wow, and thank you for tuning in to the Jones Health Law YouTube page. My name is Jamaal Jones. I'm an attorney, the principal attorney for Jones Health Law. We're based in Coconut Grove, Florida, and we provide various different types of healthcare and business law services to healthcare providers, healthcare executives, and healthcare entrepreneurs. Today, I would like to discuss an emerging trend or topic in the healthcare community, and that's the medical marijuana industry. Um, and I'm going to discuss it in relation to the Florida law and some federal law. But I'll briefly just touch on it. I just kind of wanted to give an update, if you will, as to the current state of affairs with regards to medical marijuana. As you may be aware, on November 8th, 2016, Florida voters approved the use of medical marijuana in a constitutional ballot initiative called Amendment 2. This amendment approved the use of medical marijuana in treatment for patients who suffer from specific debilitating medical conditions. These debilitating medical conditions include, but are not limited to, cancer, AIDS, PTSD, glaucoma, Parkinson's disease, Crohn's disease, and epilepsy, to name a few. Um, I think multiple sclerosis is also in there as well. Physicians may also prescribe medical marijuana for other debilitating medical conditions of the same kind or class as those that I just mentioned, and for which a physician believes that the medical use of medical marijuana would likely outweigh the potential health risks for a patient. Those looking to do business in the medical marijuana industry must proceed with some caution, because even with the passage of Amendment 2, marijuana is still considered a controlled substance, consumption of which is illegal under federal law, which creates some legal barriers or several barriers to the entry for the medical marijuana industry. Now, you may be asking, who can prescribe medical marijuana? But believe it or not, medical marijuana is a Schedule 1 drug and is regulated by the Florida Department of Health's Office of Compassionate Use. In order to prescribe medical marijuana to a patient, a physician must be licensed to practice medicine in Florida and certified by the Department of Health. Further, the physician must complete an 8-hour course and exam offered by either the Florida Medical Association or the Florida Osteopathic Medical Association. Additionally, if the physician is a medical director of a medical marijuana treatment center, they're required to take a 2-hour course. Now, as I said, even though Amendment 2 passed, there are definitely some restrictions on its use. Currently, marijuana is only supposed to be used for the treatment of medical conditions, and any recreational use in Florida is prohibited. Medical marijuana may only be consumed in the form of food, tinctures, aerosols, oils, ointments, or related products. Notably missing is the permissibility to consume or use medical marijuana in a plant-based form that can be smoked. Further, medical marijuana may only be prescribed to eligible patients as defined in Florida Statute 499.0925 as having a terminal condition. Patients will be classified as terminally ill only if two physicians designate them as such. Additionally, Amendment 2 makes no accommodations for the use of medical marijuana at the workplace, public places, or school settings. Currently, federal and private program payers are not required to reimburse patients for medical marijuana treatment. The Department of Health must register and regulate MMTCs, which are medical marijuana treatment centers, that produce and distribute medical marijuana. Identification cards must be issued to patients and caregivers. In order to receive medical marijuana, a patient must be 1. A permanent Florida resident, 2. A patient of the ordering physician for at least 3 months or 90 days, but I think that's changing if it hasn't already changed. and diagnosed with a debilitating medical condition. Now, regulators and local officials and politicians have reacted to the legalization of marijuana, as well as physicians as well. The Trump administration has stated that it intends to enforce federal law that prohibits the use of recreational marijuana, but they're unlikely to prohibit the legitimate use of medical marijuana for treatment purposes. In other words, if you're smoking marijuana just to have fun, then the Trump administration will clamp down on that usage. But if you're using it for the treatment of one of the illnesses or conditions that I had mentioned previously in the video, they're not really going to enforce any federal laws prohibiting the use of marijuana for those purposes. However, in some cities throughout Florida, legislators and local officials are still trying to determine whether medical marijuana is even legal despite its overwhelming support by voters in Amendment 2. Throughout Florida, many cities are ill-prepared to regulate various aspects of the medical marijuana industry prior to the September deadline requiring its statewide availability. Even after the Trump administration has made a public statement regarding medical marijuana, officials are wary about implementing regulations because it's still federally prohibited. However, at least 28 states have operated without significant intervention from the federal government after they have legalized either recreational or medical marijuana. Many physicians welcome Amendment 2 and feel that it's long overdue. Physicians are educating themselves on administering medical marijuana to their patients. For example, they are learning about the various strains of cannabis and how certain illnesses may respond differently to a particular strain and dosage. Many doctors prefer to prescribe medical marijuana rather than narcotics, which can be highly addictive to the patient. As a country, we're facing an opioid epidemic, and by using medical marijuana as an alternative when appropriate may help to curb the addiction and alleviate some of the ills of society faces today with regards to opioid addiction. As you may be aware, and perhaps this is why you're viewing this video, is medical marijuana is a big business and has the potential to be an even bigger business. According to reports, there might be as many as 450,000 patients throughout Florida who may be eligible to receive medical marijuana treatment. That number is expected to rise as the types of illnesses that are treatable by marijuana becomes less narrow and not limited to debilitating medical conditions or terminal conditions. According to New Frontiers projections, medical marijuana users in Florida will spend an estimated $200 million annually. And by 2020, Florida will account for 14% of the permissible marijuana use in the country. There will likely be an expansion of dispensing organizations, but it will not be easy. Currently, there are 7 approved dispensing organizations in Florida. The following is a non-exhaustive list of the Department of Health, what the Department of Health considers when deciding to approve or deny dispensing organizations' application. First, they look at the technical and technological ability to cultivate, process, and dispense low-level THC cannabis. Second, the ability to secure the premises, resources, and personnel necessary to operate as a dispensing organization. Third, the ability to maintain accountability of all raw materials, finished products, and any byproducts to prevent diversion or unlawful access to or possession of these substances. The financial ability to maintain operations for the duration of the 2-year approval cycle. 5, you have to pass a background check. And 6, post a performance bond, which can be approximately $5 million. Individuals seeking to enter into the medical marijuana industry face several other challenges due to federal laws that prohibit its manufacture, distribution, and use. Banks, insurance companies, real estate brokers are hesitant to contract with medical marijuana companies due to the existing federal laws. Since it is illegal to operate a medical marijuana company on the federal level, banks can't or are unwilling to loan individuals money out of fear that they'll be penalized for funding an illicit enterprise. This will only change if Congress takes steps or passes a measure to legalize the medical marijuana industry. In closing, legislators must quickly determine the ongoing medical marijuana education requirements for physicians and how it will be regulated. Providers will increasingly enter into the business because the law effectively shields them from civil or criminal actions that arise from their prescribing of medical marijuana. However, physicians may face discipline for wrongfully prescribing low-level THC marijuana or medical marijuana. Physicians must ensure that they receive the requisite informed consent prior to prescribing medical marijuana. It is still uncertain if Amendment 2 will expand the number of dispensaries and by how many. Also, if you're a non-physician looking to enter into the medical marijuana business, it is not clear what role one can legally play in the medical marijuana industry other than owning a dispensing organization. Again, I'd like to thank you for taking the time to tune into my YouTube page, the Jones Health Law YouTube page. This is meant to be educational and should in no way replace the advice of legal counsel with regards to these matters. If you would like legal counsel regarding medical marijuana issues or other health care related issues, please contact me at jrj@joneshealthlaw.com. You can visit our website at joneshealthlaw.com, or you can call our office at 305-877-5054. We're also on Instagram, Jones Health Law, and of course, please subscribe to our YouTube page. Thank you very much, and have a great day.